This lecture will cover digestive homeostasis and health. So by the end of this lecture, be able to define cholecystokinin, leptin, underweight, overweight, obese, malnourishment, peptic ulcer, and celiac disease. Describe how hormones mediate digestive homeostasis. List and define digestive disorders, and relate homeostasis to health. So let's look at homeostasis. Now would be a good time to remember what homeostasis is and how it works, how you have a set point where the body wants something at some level. There is a stimulus that moves away from the level, a sensor that detects the stimulus, a control center that will react to the stimulus, and a response that will bring the stimulus usually back to the set point. Remember, homeostasis is about negative feedback to bring things back to set point. And this is a hormonal control of digestion. When you start eating, you're going to have a certain amount of food, and at some point your body will want to say, stop, that's enough food. That is where we have something called leptin. This is what makes us satiated. This is a small molecule that tells our body when we have had enough. Notably, leptin is not produced directly after our body has enough food, but it takes a few minutes, which is why it is wise to eat slowly and be mindful of our eating. Gastrin is another molecule that stimulates the production of gastric juices. Food in the stomach requires gastric juices to be secreted in order to be digested. Thus, gastrin is stimulated and produces gastric juices. Again, they're not all produced at once the moment we swallow a cheeseburger whole, but they take a little while to build up to levels where we will actually need them for digestion. Secretin stimulates the pancreas to release sodium bicarbonate. Whatever could that do? Well, sodium bicarbonate is going to actually change the pH of the small intestine. It is notable to remember that the small intestine has a basic chyme, whereas the stomach has an acidic chyme. So when food is brought from the stomach to the intestine, you need to add sodium bicarbonate to make it more basic. It is also notable that sodium bicarbonate is baking soda, basically. So when you take baking soda to treat your acid reflux, you're essentially trying to make your stomach chyme more like your small intestine chyme. We'll discuss some problems with this in class. Cholecystokinin stimulates the release of enzymes from the pancreas and gallbladder to digest food in response to the detection of a high-fat, high-protein diet. If you eat a dozen chicken wings, your stomach will hold on to them longer as they are secreted into the small intestine, and your body releases secretin and cholecystokinin to make your chicken wings get digested in the small intestine. And that way, secretin and cholecystokinin also inhibit the release of gastric juices in the stomach and slow down digestion in the stomach so that the small intestine can have more time to do the digestion and absorption of this high-fat, high-protein diet. This is why foods like chicken wings take a longer time to digest and why we feel satiated for a longer period of time after a high-fat, high-protein meal. It sticks in our stomach longer. The relation of this to acid indigestion is something we'll be discussing in class. Right now, let's look at sugar homeostasis. So there is a certain level of sugar that is desired in the blood. It's a blood glucose level. After eating, the blood glucose level will rise. This is going to be a stimulus, and the sensor is going to be in your pancreas, where it's going to sense that blood levels are too high, and thus your pancreas will release insulin as a response. This insulin will transport glucose into body cells for storage as glycogen and as fats, which will cause the blood glucose levels to fall, bringing you back to a normal blood glucose. However, if blood glucose levels fall too far, this is a stimulus to move things away from a set point once again. The sensor in the pancreas and will tell the pancreas, which is also the control center, that blood glucose levels are too low, and the response here will be to release glucagon to cause the breakdown of glycogen in the liver and the release of glucose into the blood, bringing blood glucose levels back up. There is a potential for problems here. Get type 1 diabetes. This is where there's an insulin deficiency due to the destruction of these cells, and the body does not produce enough endogenous insulin. This is in contrast to type 2 diabetes, where the pancreas can release all the insulin it wants, cells are not responding to the insulin, and thus blood glucose levels will stay high in both type 1 and type 2 diabetes, but for different reasons related to homeostasis. Let's look at health a little bit more largely. So we're going to first cover obesity. This is very common in America currently, and a term for this is overnourishment. One cause of obesity is simply consuming more calories than are needed. The body stores calories in the form of fat, and as fat accumulates, an individual can become obese. Notable here that there are different hormones involved in obesity. There's ghrelin, which actually signals hunger, and there's leptin, which signals satiety. A misbalance of these can lead indirectly to overnourishment and obesity. And there have been medications to try to balance these two hormones. As fat deposits shrink, leptin secretions decrease, thus causing an individual to actually end up being hungrier. The stomach cannot shrink in and of itself, but you can actually have a medical operation to decrease stomach size and thus increase the ability to feel full with a smaller meal. There's also something called thrifty genes, which we'll discuss a little more in class. They're kind of just a side thing of obesity, but a potential evolutionary reason for it. So how do we measure obesity? Well, we have different terms here. Underweight is having a body mass index of under 18.5. Healthy is somewhere between 18.5 and 25. Overweight is 25 to 30. Obese is 30 plus. Such measures as morbidly obese are not technically actually measures. That's just some parlance that doesn't actually mean anything in medical terms. Here we have a graph showing that. You can see that Dr. Bodie on this is roughly 6'3", 6'2 3/4, and is 175 pounds. This puts him somewhere in the middle of healthy weight. Donald Trump is 6'3" and 244 pounds. This would put him in the obese category. Notably, Lizzo has lost over 60 pounds recently before the filming of this, and has decreased her weight from 308 down to 200 to 250 pounds, bringing herself down into, well, close to just overweight instead of obese. Now, there are multiple different reasons that an individual may have a BMI that is larger than their body would indicate, such as having a very dense muscle mass. Generally speaking, an individual would know if they are having an aberrant BMI because they have been going to the gym and bulking up, or because they have large fat deposits. Macronutrient disorders here, we've already looked at overnutrition, which affects nearly 70% of American adults and 17% of children. This includes some risk factors such as heart attacks, strokes, diabetes, arthritis, and certain types of cancer. But we're also looking here at undernourishment. So undernutrition is in two forms here. First off is anorexia nervosa, resulting from insufficient caloric intake and excessive exercise. And this can be somewhat of a nervous disorder and can be very cultural. There's also bulimia nervosa, which includes cycles of overeating and then purging, often by vomiting. Risk factors here include heart failure, malnutrition, tooth decay, and esophageal corrosion by the exposure of the esophagus to stomach acids during purging sessions. A lack of fresh fruits and vegetables can cause scurvy due to a vitamin C deficiency. Such was seen in a lot of transatlantic crossings that took too long when people were surviving on salt pork and hardtack and a bit of grog. This is why limes were added to the diet of sailors to increase the amount of vitamin C and fight off scurvy. Calcium absorption decreases when taken alongside cocoa, which is because catechin and epicatechin in the cocoa will bind to calcium and decrease its bioavailability. This is why chocolate milk and milk chocolate have less available calcium than simply milk. Chocolate on its own actually has less available catechin and epicatechin when it's given in the form of milk chocolate compared with dark chocolate, which is why dark chocolate is healthier than milk chocolate. Soda intake also decreases calcium absorption and even decreases magnesium absorption, which is why many Americans, unbeknownst to them, have a magnesium deficiency. Fast food diets can cause both overnutrition in the form of too many calories and malnourishment by not having enough vitamins and minerals. Peptic ulcers are another problem in the stomach. These are often associated somewhat incorrectly with stress and spices. They are actually due to a bacterium called Helicobacter pylori. Antibiotics are a common remedy for peptic ulcers because it kills Helicobacter pylori. Why is Helicobacter pylori there in large numbers to begin with? Well, possibly because antibiotic exposure early in life can damage the ecosystem of the stomach and cause imbalances in the bacteria, allowing Helicobacter pylori to become more common. Gluten. Some people have told me gluten isn't a real thing, it's just made up. No, it's very much a real thing. It is a protein found in wheat. And as such, proteins that were found in wheat were not evolved with by most humans. Most humans did not evolve with gluten until the agricultural revolution, specifically in the Middle East and China. Any other culture would probably not have been exposed to gluten before then. Thus, we have certain problems digesting gluten, and this is just naturally in us. One problem is celiac disease. This is an immunoreaction to gluten, and the breakdowns of gluten interact with the immune system, which then, unfortunately, attacks the gastrointestinal tract. Symptoms include bloating, diarrhea, pain, and ultimately malnutrition. Opiates are another problem to the digestive tract. Opiates, as a side effect, cause non-propulsive contractions in the small and large intestines, which do not move the bowels forward, allowing them to have a higher residence time. And as they have a higher residence time, the colon will absorb more water from them, causing the chyme to become harder and more difficult to pass, which leads to constipation. We're going to discuss diet and health in class, talk about things like food deserts, the paleo diet, cultural foods as both positive and negative, and the expense of food. I would recommend this reading for you, Michael Pollan's In Defense of Food, with a simple manifesto. Eat food, not too much, mostly plants.